We must take the vaccine. Now, I'm going to tell you a personal story, off script. So today, right after this, I am going to have an infusion. And I'm going to have an infusion because I want to make sure that the cancer that was in my body does not return. I'm not asking what's in the infusion. I'm not looking up all of the ingredients in the infusion. I am sticking out my arm and I am taking the infusion.
Why don't we blow the system up? I mean, obviously we can't just turn off the spigot on the system we have and then say, hey, everyone in the world should get this new vaccine we haven't given to anyone yet. But there must be some way that we grow vaccines mostly in eggs, the way we did in 1947.
In order to make the transition from getting out of the tried and true egg growing, which we know gives us results that can be, beneficial. I mean, we've done well with that, to something that has to be much better. You have to prove that this works. And then you've got to go through all of the clinical trials, phase 1s, phase 2s, phase 3, and then show that this particular product is going to be good over a period of years. That alone, if it works perfectly, is going to take a decade.
There might be a need or even an urgent call for an entity of excitement out there that's completely disruptive, that's not beholden to bureaucratic strings and processes.
So we really do have a problem of how the world perceives influenza, and it's going to be very difficult to change that unless you do it from within and say, I don't care what your perception is, we're going to address the problem in a disruptive way and in an iterative way, because you do need both.
But it is not too crazy to think that an outbreak of a novel avian virus could occur in China somewhere. We could get the RNA sequence from that, beam it to a number of regional centers, if not local, if not even in your home at some point, and print those vaccines on a patch and self-administer. To more synthetic, the nucleic acid-based, messenger RNA-based, those sequences can be rapidly shared around the world. Enzymes that can synthesize the small fragments of messenger RNA necessary to go into the vaccine can be made in a shoebox size system right now, which is translatable into a 3D printer-like or inkjet printer-like thing. Now, putting those in a system to print those on a patch that a self-administered vaccine could happen. The technologies are out there. We haven't demonstrated their true effectiveness and the ability for a vaccine, but it is not too crazy to think that an outbreak of a novel avian virus could occur in China somewhere. We could get the RNA sequence from that, beam it to a number of regional centers, if not local, if not even in your home at some point, and print those vaccines on a patch and self-administer. We're a ways out, but the technology is there, and print those vaccines on a patch and self-administer. And print those vaccines on a patch and self-administer.
And print those vaccines on a patch and self-administer. And print those vaccines on a patch and self-administer. And print those vaccines on a patch and self-administer.
We're a ways out, but the technology is there. Beam it to a number of regional centers, if not local, if not even in your home at some point, and print those vaccines on a patch and self-administer. We're a ways out, but the technology is there to be adapted and assembled to put in that futuristic view of a rapid response to an emerging novel threat. Beam it to a number of regional centers, if not local, if not even in your home at some point, and print those vaccines on a patch and self-administer. We're a ways out, but the technology is there to be adapted and assembled to put in that futuristic view of a rapid response to an emerging novel threat.
Okay, so if you aren't asking yourself the obvious questions, you probably don't have a fucking pulse or lack critical thinking skills. I think the next pandemic will happen in 2025 and then they will push a new vaccine that is, quote, self-administered, sent directly to your home. They are gonna know if you take it or not. Still think I'm bullshitting? Fine, that's okay. Haha, maybe I am just an anon shit poster making stuff up. Anywho, yeah, I'm going to read from an article from 2019 describing what sounds like the same technology that Rick Bright asshole was just talking about. A literally self-administered vaccine. I think they are going to push that hard when we have pandemic 2, as Bill Gates liked to refer to it. Anyways, here's what the Smithsonian article says, and then there's one more article I found, but I'm not gonna read it, just look it up for yourself and archive it. Anyways, here's the article talking about this strange new vaccine coming, and like I said, I reckon it will be coming out after a new pandemic, maybe sometime in 2025. Alright, here we go. The human body is an extraordinary record keeper. Tattooed into its skin are the scars of old wounds, archived in the molecules of the immune system are the traces of past infections. But when that history gets translated into written medical records, things can quickly get dicey. Every lost sheet of paper or inaccurately tallied statistic can raise a person's risk of receiving inadequate care, an especially pressing issue in low- and middle-income countries, where healthcare resources are often scarce or inaccessible. The consequences go far beyond a missed injection. Inconsistent record-keeping is thought to play a large role in the 1.5 million deaths that occur due to undervaccination each year. Now, a team led by MIT scientists has come forward with a bold proposition that could write a legible vaccination history back into the body's repertoire. Solving medicine's record-keeping riddle, they argue, might just involve injecting patterns of invisible nanoparticles under the skin. Like QR codes, these designs could be scanned and interpreted by smartphones, and someday allow health providers to archive and access patients' past vaccinations without the muss and fuss of external records. The tattoo-esque technology, described today in the journal Science Translational Medicine, is still in the early stages of development, and hasn't yet been tested in humans. But the team's experiments in rats suggest that these medical marks are both safe and long-lasting, and can be administered alongside vaccines without compromising efficacy. If the team's research progresses, future efforts will focus on delivering the technology to children in low- and middle-income countries, where many still rely on paper cards or certificates to track their vaccination history. But other experts caution that both technical and ethical hurdles might stymie its implementation, including in places where new tools to combat the spread of disease are needed most. Figuring out how to keep better track of vaccination is incredibly important from a health systems and public health perspective, says Johns Hopkins University bioethicist Nancy Cass, who wasn't involved in the project. But injectable nanoparticles that reveal private information about a patient could be ripe for misinterpretations and rumors, she says. That's especially true given the fraught history of vaccination in countries at all socioeconomic strata, including the United States. With similar concerns in mind, the researchers, led by bioengineers Robert Langer and Anna Jakelnek, are preparing to conduct surveys to assess whether the invisible tattoos would be accepted by locals in high-priority regions. Backed by the Bill and Melinda Gates Foundation, interviews in Malawi, Bangladesh, Benin and Kenya will begin early next year. We want people to be comfortable, says study author Kevin McHugh, a bioengineer at Rice University. The goal is widespread adoption. Though somewhat comparable to tattoos, the marks themselves are nothing like traditional ink. Delivered by a microneedle patch, a 4x4 grid of tiny, 1.5 mm long spikes that hurt less than typical injections, they're made up of nanoparticles that are undetectable in visible light, glowing only when viewed in infrared. Over the course of 2 minutes, the nanoparticles diffuse from within the microneedles to a shallow layer of skin, where they're deposited in simple patterns of dots, each smaller than your garden variety freckle. The patch is then removed, leaving behind a subtle mark that can still be imaged after being exposed to the equivalent of 5 years' worth of sunlight, the team's experiments show. This ties the vaccine to the record itself, and ties the record to the person, McHugh says. It can never be lost, it can never be counterfeited. From there, reading the dots becomes a lot like scanning a QR code. Though invisible to the naked eye, dots stamped onto pieces of pig and human skin lit up in clear patterns, a circle, rectangle or cross, when viewed through a smartphone fitted with an infrared filter, the team found. In theory, each symbol could denote a different type of injection, McHugh says, and be read through a simple machine learning algorithm that the team's already written and tested. Even with multiple shots, he adds, the marks are small enough that your whole array of vaccines could fit within a couple inches. Although the nanoparticles themselves don't contain medically relevant drugs, the researchers safely delivered them to rats alongside a polio vaccine, which seemed to still confer its protective benefits. That's the ultimate goal, McHugh says, to always administer the medicine and the marker in tandem, so there's no risk of getting one without the other. And when the team scanned the rats 9 months later, they could still identify the symbols the microneedle patch had left. 9 months is a long time for rats, which live only a couple years, but the blink of an immunologic eye for a human. The next step, McHugh says, is to test a similar protocol in longer-lived animals like pigs, which share a lot of anatomical commonalities with humans, including the structure of their skin. Ideally, the formulations will remain detectable for at least several years, and perhaps longer, as most vaccinations are delivered during early childhood, McHugh says. These longer-term experiments will also give the researchers the opportunity to do more testing for toxicity and other side effects. Though the dot's glow eventually fades, the nanoparticles stick around for good. For now, the patches can only encode a handful of simple shapes. But adding more microneedles could make the designs more intricate, potentially conveying information about a vaccination's date, dosage, lot number and more. To eradicate diseases, like polio and measles, Jakelnek says, you really need this kind of data. More complexity, however, also introduces the possibility for more error. If the nanoparticles are misapplied, fast-fading, poorly imaged or even misinterpreted, public health officials could end up back at square one on the record-keeping front, points out Grace Lee, an infectious disease pediatrician at Stanford University's Lucile Packard Children's Hospital who wasn't involved in the study. What's more, the team's study represents the first pass at a product that could take years, even decades, to develop and clear stringent safety regulations, says Derek Carter, a vaccine development expert at the Infectious Disease Research Institute in Seattle who wasn't involved in the study. It's already difficult enough to get vaccines cleared to go into these countries, he says. An accessory procedure like this, he says, could meet further resistance. And that's just on the practical side. Making a technology usable doesn't guarantee it'll be used, and there are plenty of reasons why patients might hesitate to sign on to such an unusual procedure. One of the biggest issues, Lee says, involves privacy, something that's already a hot-button topic in the realm of health records. Carrying medical information on the body, even in a form that's invisible, without a special filter, could invite stigma, discrimination, or worse. The idea of administering tattoos en masse may not be well received, adds Kendall Hoyt, a biosecurity expert at Dartmouth College's Geisel School of Medicine who wasn't involved in the study. Potential patients could reject the procedure out of fear or mistrust, worrying, for instance, that authorities are using the patches to encrypt information onto individuals. Add that onto the backlash that already comes part and parcel with vaccines on the whole, and the situation could compound hesitancy and misinformation, she says. Given the nature of these issues, the team's tattoos could end up widening the chasm between patients and health providers, both foreign and local, Cass says. If communication about the product isn't initiated early, I worry about the unintended consequences, she says. It could make things worse than they already are. McHugh stresses that if the microneedle patches someday make it out to the field, they won't be mandatory accompaniments to vaccination, and nanoparticle-free formulations would be available at the same sites. The team's upcoming surveys, he adds, could also help the researchers adapt their product to patients' needs, desires and concerns. That's critical, Cass says. Bringing in the voices and opinions of the people who stand to benefit the most from the product is something that should start early, and continue. After all, there's no point in advancing a technology that no one's going to use. At the root of it all, the tattoos still address a very important problem, Hoyt says. It just has to be approached in the right way. It remains to be seen if these microneedle patches fit the bill. Figuring that out will require a robust discussion to optimize the use of this technology in an ethically appropriate fashion, Lee says. You want to advance science. But you also want to be mindful of the potential impact that science might have. The idea of administering tattoos en masse may not be well received, adds Kendall Hoyt, a biosecurity expert at Dartmouth College's Geisel School of Medicine.
But it goes into your skin, and the little tiny microneedles will be injected. So what's in a microneedle? It'll be either the DNA or the RNA vaccine. Number 2, it'll be something called luciferase. Now this is very important to know. They patented an enzyme called luciferase, okay? So this is called luciferase, they claim, because it gives a bioluminescence, a light, okay? And it's not something you can see or feel, but if you have a special device like a smartphone app with a special application, you can scan over it and it will light up. It'll show a pattern, a digital code, a barcode, a tattoo. We're going to be branded. Each person will have their own ID. You know, this reminds me of World War II. You know, it's something to think about, being branded like a product in the store. So that will be in there, and that will hold proof that you're being vaccinated. They want to make sure that you're scanned and that you've gotten the vaccine. So we'll be branded. What could that be used for? Well, there's lots of technologies out there, but it's something that we need to be concerned about. So there's 2 things. We have a brand new experimental DNA or RNA vaccine that could potentially alter our genome. And number 2, we're going to be tattooed or branded with an ID. And then number 3, this is all in a hydrogel. So hydrogel is a technology that was invented by DARPA, Department of Advanced Research Project Agency. Now this is a small part of the Pentagon or the Department of Defense. Look up on YouTube, hydrogel, the company Profusa, and DARPA, and you'll see some clips of some of the technology of this. So this is a special technology because it goes under the skin, the body doesn't reject it, and it has nanotechnology, which are microscopic robotic organisms. So these microscopic organisms that are robotic will be in your body.
The FDA knew as of October 22, 2020 all of these possible side effects and adverse reactions. Yet the vaccines came out 2 months after, in around December of 2020. How is no one still not talking about this? This should infuriate you. Were you warned of these potential side effects? No. I doubt it. You probably didn't even hear about them. Because Big Pharma was telling you it was safe and effective. Don't believe me? Fact check this, look up. It's still on the internet. Go to FDA website. You'll see. And this is a screenshot from their internal slideshow that leaked everywhere way back in 2020, but I think many people may have forgotten that weight this one picture potentially holds in proving that there was and still is censorship and cover-up on a mass scale, potentially even point to a mass conspiracy against we the people. Think for yourself, you decide. Slide from page 18 of Vaccines and Related Biological Products Advisory Committee October 22, 2020 meeting announcement.
I'm not asking what's in the infusion. I'm not looking up all of the ingredients in the infusion. I am sticking out my arm and I am taking the infusion.
Beam it to a number of regional centers, if not local, if not even in your home at some point, and print those vaccines on a patch and self-administer.
Ha 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 ha! ha 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 ha.